Hello, Kimmy.
Hi.
Nice to see you again. It's a pleasure. So from your previous physical exam, when we went through all the ranges of motions and stuff like that, you came in with the chief complaint of lower back pain, right?
Yeah.
And so what we went ahead and did is we took some x-rays, and we're going to go ahead and talk about them and share them with you, all right?
Okay.
And then next, we're going to go ahead and move into our treatment plan after that, and we'll talk about that in a little bit. So what we're looking at is your lumbar spine, right? This is what the model of your actual spine is supposed to be like, and the region that we're looking is about from here to here, right?
Okay.
And if you notice the integrity of it, it's pretty straight, and these nerve fibers, which are the yellow parts, they come out of these little holes, and we call those intervertebral foramen, right? They're like the doors that allow the nerves to come and communicate within with your muscles, also with your organs and stuff like that, and your brain.
Oh, very cool.
So, do you see anything that's abnormal here within this region?
It doesn't look like it's completely straight.
Yeah, so this is your left side for the L, and then this side would be the right. So I'm going to go ahead and just kind of mimic what your body's doing. And I'm kind of bending this, right? And can you kind of notice in this region that's kind of causing pressure?
Yeah.
And kind of, yeah. So within that, that's called a subluxation. And what it is, a subluxation is that your vertebral bodies actually misalign. And when they misalign, like we just saw, the nerve, they actually causes like a barrier or an obstacle that kind of causes the brain to not properly communicate with the body. So like your muscles, and that's why you get inflammation, and a lot of that pain is associated with that. Right?
Okay.
So next, what we want to really do is try to prioritize this and try to get that, restore that curvature. But with things like this is called scoliosis to some extent. It's not to that region. You don't have scoliosis, but this is what chiropractors call as a scoliotic curve.
Oh, okay.
And, excuse me. With that, we would like to see you about 2 times a week for 8 weeks. And why this is so important, a lot of patients ask us, I kind of bring it to the, do you have a car?
I do.
You do,
yeah.
Right? Do you change the oil all day and maintain the tires, right? So everybody rotates their tires to keep the treading on the tires so that you can use it for a longer period of time. Also, changing your oil, changing your spark plugs. We need to maintain our car so that it works in longevity, right?
Right.
So we want to also do that with our body, right?
Okay.
So with the adjustments that we deliver, these are going to help restore your structural integrity, not to where it's going to be straight, but to where your body adapts to it so that you can function on a your most optimal on a daily basis, right?
Okay.
And so some of the goals that I would like to get out of this is that we reduce the pain from a 4 out of 10 in your lower back to a 2 out of 10, and also just increase how much you can work out. Because I remember you saying that sometimes when you're working out for a long day,
yeah, it's hard for me to work out if I'm feeling too much pain.
Yeah, and then also sometimes I remember you saying that even when you don't work out, say you had a hard workout, a couple of days later, you couldn't go about your daily stuff, right?
Yeah.
Yeah. So we're going to try to see what we can do and cater to that and try to make that for your body to adapt so that you can do whatever you need to do to the best ability. But before we go ahead and do that, I want to talk about some health risks. So a lot of patients come in and they always ask, are you going to break my bone? Are you going to break me up? And so it shows with some research that it's very minimal when we deliver adjustment that we're actually breaking your bones and stuff like that, right?
Okay.
What we do is that we go in here, we make specific contacts with specific points within our hands, and we deliver these adjustments. And that's just going to increase your overall health. We're not going to say like it's going to cure anything, but form equals function, right? So if we get that form in your spine and relieving all those neural dysfunctions and subluxations, we're going to go ahead and see where that brings you, okay?
Okay.
Is there any questions? I know I kind of ran through that a little bit fast, but if there's any questions at all, feel free to ask.
No, a lot of this actually made a lot of sense.
Okay.
So how often am I seeing you?
So we're going to see you for 2 weeks.
Okay.
I mean, 2 times a week, sorry.
Okay.
For 8 weeks. And then based off that, we're going to go ahead and do a reevaluation, which is like a very quick physical exam because we already did one.
Okay.
And we're going to see how much of an improvement you are. And then if we can try to get you down to maybe once a week for 4 weeks, you know.
Okay.
But we want to kind of facilitate that and kind of see
So we can start tapering it down.
yeah, where you're going from.
Awesome.
But if at any point, you know, you have discomfort with adjustments and stuff like that, please feel free to let me know in any duration of your care plan, because you know your health is our top priority. So, yeah. So let's get this show.
I also had one other question.
Yes. What is it?
Is there anything that you want me to do at home, or
Oh,
am I
yeah.
just seeing you
I
here?
totally forgot. Yeah, thank you for reminding me of that. So like we talked earlier, we do have some home activities and stretches, and I forgot to mention that this is going to be a team effort. So what I mean by that is that you have to meet me halfway. So with these adjustments that we do here at the facility, it's going to help correct your posture and a lot of things that are going to give you that signs and symptoms of lower back pain. But when you get home, we have these stretches that are going to help increase the functional range of motion, the movements, and making sure that your spine stays in line as long as possible, but with the stuff that you want to do.
Oh, okay. Yeah,
and
that
I
sounds
actually
good.
have some forms, and we'll go to the gym in a sec right here outside, and we'll basically go through those
Oh,
and
perfect.
make sure that you know what you're doing, what form you have is right, and we'll set you on your way. Yeah.
Okay.
Sound good?
Cool. Thank
Cool.
you.
Always a pleasure.
I appreciate it.
I talked to Mo.